Today discussing about the role of the nurse endoscopist. It's a unique invention of the British Society of Gastroenterology to deal with the rising demand of the endoscopy procedures. It was introduced in 1990. Since then it has grown tremendously, and now the 8% of endoscopists are the nurses, and they do a tremendous job, and 20% of the endoscopy procedures in UK are performed by the nurses. Their job plan is very flexible, so they can backfill any vacant session. Like the doctors are a little bit fixed, they have their job plans a bit fixed. So I have been teaching, training and mentoring the nurse endoscopists for the past 15 years, and this is only in Britain. This idea hasn't taken up in the rest of the world, and we are hoping, or we are aspiring to take this idea into the subcontinent so that the patient can have access to the rapid access to the endoscopy procedures.
I've worked in the Trust now since 2000, and I've been scoping since 2004. I currently perform gastroscopies, flexible sigmoidoscopies and colonoscopies. As a non-medical prescriber, I work autonomously and I work independently. So I only need doctors or a multidisciplinary team if there is a concern about a patient or a concern about a procedure. There are lots of roles developing for nurse endoscopists in the UK at the moment, with patients and nurses taking on procedures such as endoscopic mucosal resections, bowel cancer screening, so there's lots of an opportunity for advancement. Within my role, I've chosen to go down the role of teaching, and I teach doctors and nurses alike to the same standards as required by JAG and the accreditation for independent practitioner status. I've been doing that since 2010, and I've currently trained 6 healthcare professionals, both nurses and doctors, to do the procedures. Nurse endoscopists, however, in this role are very few and far between. Back in 2015, there was only 10% of all trainers in the UK that were nurses training doctors. Within the West Midlands, there was only 5 of us. Since then, I know a couple more have trained, but it's still very lacking. We're flexible, we're consistent, we're good at providing steady and assured care for patients while training sessions are happening.
As a trainer, I do realize the importance of adequate training and supervision for anyone undertaking endoscopy. Training has also become multidisciplinary over the last several years. Culture of training has changed. Nurses usually are very protocol driven, and that helps especially when training a trainee with a limited experience of endoscopy. It is also important because the dimension that's been brought in by this multidisciplinary approach of having nurse endoscopists on board, that it has contributed in a way that I think we can plan our future better. I believe that nurse endoscopists can contribute even more than what they've already done to the gastroenterology service and training in this country. Learning endoscopy is not just learning about the skill, it's essentially understanding the whole management of endoscopy service. Nurse endoscopists have contributed significantly to endoscopy service and training over the last several years.
I'm a gastroenterology ST4. I have been training in gastro for a year and a half now. I did my previous training at Hereford Hospital, now I'm at Worcester Hospital. I've been training with nurse endoscopists since then. They've allowed me to go from being a total beginner in endoscopy up to being JAG accredited now. So I really appreciate all the help that nurse endoscopists have given me during my time. So now I can independently perform diagnostic upper GI endoscopy, so I'm responsible for that patient experience from beginning to end, whereas before I would be reliant on a trainer to observe and assist if needed. Now that's be my responsibility. Currently I'm still training and will be for until the end of my registrar training. I'm currently learning how to do lower GI endoscopy and have contact with nurse endoscopists too. And I would also encourage nurse endoscopists to train registrars because I think they have a lot of experience and skills that can be passed on to registrars.